Welcome to the Rx Physiotherapy Podcast, your go-to destination for all things physio, rehab, health and wellness. I'm April Patterson.
And I'm Brendan Chase.
And each week, we will dive deep into fascinating topics within the health world. From physiotherapy to nutrition and beyond, we cover it all. So sit back, relax, and enjoy the journey as we explore the exciting world of health and wellness.
And before we begin, we'd like to acknowledge the traditional owners of the land which we meet today, the Dharawal people, and pay respect to elders past, present, and emerging.
Let's get started.
Good morning, good afternoon, good evening, depending on who's listening and what time you're listening at. Welcome to the Rx Podcast for patients, physios, personal trainers, anyone interested in health, wellness, or living a physical, best and capable life. My name is Brendan Casey. I'm a physical therapist. I'm a physiotherapist from the Illawarra region, and I'll be acting as truth seeker today. Co-host is Dr. April Patterson, physiotherapist and director of Rx Physio. Good morning, April.
Good morning.
Plan moving forward with this is to cover a wide range of topics, from dietetics, medical conditions, long-term sports rehab, post-surgery, treatment strategies, acute injury management. But that list will go on and on and on, I'm assuming, as this tends to evolve. That being said, we're going to make sure this is an educational podcast. So if you do have any physical ailments, please go seek out your allied health professional for a full in-depth assessment. And before we begin, we'd like to acknowledge the traditional owners of the land which we meet today, the Dharawal people, and pay respect to elders past, present, and emerging. April, I think we confirmed that we're going to start a 1 or 2 part series on hypermobility. Yep. Right? Why don't you tell us your background as a physio and then your own experience with it as well, and why it's something that you lean towards so much?
Yeah, so I have a hypermobility condition called Ehlers-Danlos. I have the version that affects the joints and the muscles and my gut as well. I have also been diagnosed with ADHD, which we will explore during this podcast, as there is a correlation of 1 in 2 people.
Right.
So I was that kid that was really active and had a lot of injuries as a result, probably because my mum had 3 kids with ADHD that she needed to tire out every day.
Mm-hmm.
So I spent a lot of time at the physio and was always fascinated by the human body, and just, I guess, having that first-hand experience of having constant injuries. So I didn't realize that I was hypermobile or had ADHD until I was like mid-20s. And we'll talk about the ADHD side of things a bit later. But with the hypermobility, you were just that flexible kid. It was a party trick. You didn't realize what the implications it had. So when you have hypermobility, to keep your body up against gravity is just a lot harder than the average person. So your body's working a lot harder. This has helped if you have a lot of redundancy in your muscular system to be able to control the muscle, control the joints. But if you have perpetual injuries, it's really hard to keep your body strong unless you have a specific recipe that's going to work for you. I guess for me, having hypermobility, knowing how to go about it so that I can heal my injuries and keep active is something that has helped me with my life, and I'm really passionate about helping others do that too.
Awesome. You've been practicing for how many years now?
Nearly 6 years.
Right.
Yeah.
And what kind of things or background in physio have you had in that time?
I have worked solely in private practice musculoskeletal. Mm-hmm. So I see general population, a lot of CrossFit athletes, and a lot of individuals with hypermobility. So quite a wide scope of context. But with the muscular system, it all comes down to the anatomy at the end of the day. So yeah,
okay.
You can see the similarities.
Fair enough. All right. We've already touched on what hypermobility is and how it relates to EDS. What if we jump into the kind of like common symptoms, and then we can use that as a jumping off point to like how we diagnose it and how we differentiate that between someone who's just a little bit more flexible and someone who actually has a hypermobility condition?
Yeah, that's a good one. So signs and symptoms, you or someone you care about will be that really bendy kid that has all the party tricks, but also has multiple injuries or chronic fatigue. They, at the same time, will have a lot of symptoms to do with their gut.
Mm-hmm.
Up to 90% of individuals with hypermobility have what we call autonomic dysfunction, which is essentially your body's ability to maintain your blood pressure in different gravitational situations. So you'll see the person stand up and become dizzy quite quickly, or just be generally so fatigued from having to work so much harder to do something that is automatic for everyone else. So again, it'll be that person that constant injuries in multiple limbs, always fatigued, and has a lot of issues with their gut and their ability to maintain their blood pressure.
So this goes way beyond just someone who's slightly more flexible than the average person. Someone who's been, although I do think a lot of people who are a bit more flexible have been called double jointed throughout their life, where people who live with these conditions as well definitely called double jointed, and it's kind of just a broad brush stroke, and people are like, oh, don't worry about it. But then they run into these problems fairly early on. Because when did you really start experiencing symptoms?
So again, because I was always so active, I didn't have any of the musculoskeletal symptoms that I did when I started being more sedentary whilst I was at uni.
Mm-hmm.
But for the average person, for someone who isn't as active as a kid, it is quite early on in life.
Right.
Yeah. The kid that is, well, really delayed in all their milestones, really slow to walk, really slow to learn how to catch a ball and kick a ball. And also that kid that just seems really tired all the time, like sleeping a lot. You may consider them to be lazy, but really their body is just working so much harder to stabilize themselves, to walk around, which most people just take for granted.
Fair enough. And that makes a lot of sense from
Yeah.
what we were talking about before, that the muscular system is working overtime to just do the bare basics.
That's right.
Right. Fair enough. What's the, going to more of the statistics side of stuff, what's the kind of most common, like if you were to put like a stereotypical person walking here with hypermobility or EDS, is it going to tend to be more female versus male, older versus younger? And then from there we can move into like, what's the correlation to ADS or ADD or ADHD?
Yeah. So the most typical individual would be a female who is still early on in her life. As we get towards later in life, our joints do stiffen up, and that comes with a bunch of other issues. But it'll be that girl who's gone through puberty, grown really fast, has pain in multiple joints, is feeling quite anxious constantly. And this is something we'll get into a bit more. But in order to keep your body functioning at the level everyone else, well, most people can just typically, your body has to use a lot of stress chemicals to free energy, to give you more energy. It's also why you get the crash. So it'll be that girl who seems really flexible, a bit subdued, anxious, and has constant pain in every joint.
Right.
Yeah.
What kind of joints have you found, and what do the statistics say about like the most commonly affected areas?
Definitely lower back, neck, shoulder, and jaw would be the most common. Yeah.
So the lower body kind of gets a little bit of a and I'm not saying it doesn't happen, but definitely not as common as the upper half.
Yeah. So what I find is the knee and the ankle, they do end up having issues long term, but it's more the hips and the lower back that like take the load at the start.
Fair enough.
And then with the shoulder being the most mobile joint, if they're pushing their shoulder into ranges that they don't have strength for, they'll have dislocations or just constant pain. And then neck is a big one. So we all sit in less than optimal positions these days, which
Just adjusted my posture. I said that.
we're required to sit much more than we were ever, that we've adapted to be able to do. And a good way to think about it is if you had to hold a weight away from your body with a straight arm for hours on end, it would be really tired versus if the weight was close to your body. So now our heads are poking out forward and our muscles are having to work so much harder that you end up with one, imbalances, overuse, and pain dysfunction.
Okay. Before we move into the neurodivergency thing, it's still early morning, my pronunciation isn't great. What kind of long-term effects do we see with these type of patients?
So as they start to age, their joints will stiffen up to protect themselves, and this will look like osteoarthritis.
Right.
So they'll be the individual that looks like they've never been hypermobile because their joints have just
Gone so far the other way.
Exactly.
Right.
So then you end up with osteoarthritis symptoms, which also causes muscle inhibition, so they end up really weak. And the other thing that is correlated with this is osteopenia and osteoarthritis.
Just a lack of loading and...
Exactly.
Okay, fair enough.
So we see that a lot.
Have you seen in your practice that there's a small period of time where patients almost feel a bit better before this kind of joint stiffness really takes hold? Like there's a bit of a butter zone where the hypermobility has been counteracted by the joint stiffness and they might feel okay for a couple of years and then they go off the other end of the spectrum.
Yeah, I see what you're saying with that. Yeah, it's like they'll stop having as many like instability symptoms.
Right.
But then progressively it will turn more into pain and stiffness versus instability.
Right.
Does that make sense?
No, it does.
Yeah.
And it's a bit of a cruel joke in a way, isn't it? That
Yeah.
they're looking for stability so early on in life. And then very quickly they get it. And then they're like, oh, now I'm too stiff. I'm too stable.
Exactly. I can't tell you how many times I've had someone come in who's over 65 and I've been able to identify that they were definitely hypermobile when they were a kid, but they have no mobility anymore.
Fair enough.
So, yeah, it is a bit of a cruel joke.
Just a bit. Let's go into the neurodivergency side of things.
Yeah.
How does it correlate? And can you have autism spectrum disorder or ADD and not be hypermobile? Or vice versa?
Yes. So the latest research shows that 1 in 2 people who have a neurodivergent diagnosis will be hypermobile. So
Quite high.
very high. And what is really interesting is that as the research emerges, that number will go up because until now, the screening test that we have only looks for joint hypermobility. And as we know, the changes in collagen that cause hypermobility actually affect the entire body. So we're actually not looking at most of the body. And men don't present as hypermobile as women do. Women will, just due to hormone changes, and they will be much easier to pick up. Whereas with men, they'll be the ones that have the really stiff hamstrings. It will look almost like they don't have hypermobility, but they'll have the gut issues, the stretchy skin, like all the other symptoms. I think that's where, and this is just anecdotal, this is evidence-based, it's just my opinion, I think that number will be higher when we start looking at that stuff.
As we look closer and closer.
Yeah.
And I would, in the not just from today, but the conversations that we've had about it, and you passing on the knowledge to me, it's made me more aware how prevalent it is. And whether I'm starting to convince myself I do have some traits.
I'm bringing you down with me.
Or whether, same again, or whether you're just in that realm of, you're just a bit more flexible.
Exactly. And that's a good point to make, is there's multiple different diagnoses within hypermobility, but you can also have generalized hypermobility without any symptoms. So you can be flexible, but unless you have the symptoms that are leading to dysfunctional presentation, as long as you're strong, it's not something to worry about. Then these are like the dancers. It can be really beneficial. But when it starts to cause things that impact on your life negatively, that's where we need to intervene. And if someone comes into me and I'll look at what their main issues are, and if it's mostly gut issues, I'll send them to someone who can help them with that. If it's mostly physical issues, obviously I would help with that. And if it's manifesting more so in anxiety, issues with their blood pressure, the rest of that, then I would send them to that health professional. So what I'm trying to say is you need to look at the person and go, what are they struggling with? And help them to work on those symptoms. It's not just a one-size-fits-all. Everyone with hypermobility is very different.
No, that makes a lot of sense. And the fact that there's no, for what I would say as well, that you're like, oh yes, you definitely sit in this camp or this camp, but there's so many people in between.
Yeah.
And touching on what you said before on if they're just generally hypermobile, but it's more of an advantage, and then those people will naturally move towards those activities like dances or athletics. It's not a problem unless it becomes a problem.
Exactly. And we will go through this in the YouTube clip too. I've got a good little diagnostic criteria that you can look at and see where you fall if you do feel like you are someone that you know could be hypermobile. So yeah, we'll have some infographics on there.
So staying on that topic of neurodivergency, one question I had personally was, from the research, if someone's higher on the spectrum or more affected by these cognitive and brain changes, do those people see greater change than hypermobility if they are positive in that area? Or is it more they're correlated, but they're not, if one's quite high, the other one's quite high? Does that make sense?
So you're trying to, what you're saying is that the more hypermobile someone is, the more severe their symptoms are in other areas?
Yes.
Yes. Not always.
Okay.
Yeah. Yeah.
So am I right in saying that someone could be possibly living quite an assisted life, a lot of problems with like anxiety or problems speaking, where their mobility or hypermobility could be close to a non-issue?
Exactly.
Okay.
So true. And this is where it can just be part of the overall pattern. So like a psychologist would look and go, they have all these symptoms and they're hypermobile. Okay, that's correlated. But if that's not a big issue, in saying that, exercise is the most effective way to manage
Anything really.
So if your hypermobility is holding you back from exercising, or even so, if you're deconditioned and it's so hard to just even like stand up against gravity and walk around, you're not going to have a lot of energy to manage your neurodivergence. Exactly. You're going to be exhausted all the time, which we all know how well we manage stress when we're exhausted.
Yes.
So, and again, we'll go into this in the next podcast, but exercise releases so many neurochemicals that balance the brain. I personally do take dexamphetamine, and yes, that definitely helps. But if I don't exercise, nothing helps. It's essentially, it is the number one way that I manage.
We know there's more and more funding finally being pumped into the exercise physiology space, and more people, say on the NDIS, getting more funding for personal trainers or EPs or even just physio, because we're seeing from the research and we're seeing the effects of it. Even like low-level stuff has had a huge effect physically and mentally. I mean, there's a reason there's an EP on every psychological institution as well, because we know it worked.
100%. It is definitely the number one way to treat it. In saying that though, and we will go through this in the next podcast, you have to do it in a specific way, because if your body is already not coping with life and you go and put a bunch of exercise on top, you're just going to make it worse. So you got to do it in a very intentional way.
Right.
Yeah.
And that comes back to the idea that your body only knows stress.
Yes.
Whether it's good stress or bad stress, it's just stress. So only doing as much as what it can cope with at that time.
Exactly.
Allowing it to adapt, and then slowly building up more and more and more.
Exactly. No, the perfect point.
Cool. Okay. let's actually talk about the diagnosis stuff again.
Yeah.
Right now, the main one that everyone's familiar with is the Beighton score. Yeah, is that correct? Yep. And that only focuses on the physical side of stuff, like you said.
Yeah.
How does someone go about the more physiological side of testing? Like, is there blood tests involved? Do they take specimens, or is it more genetic testing?
So to diagnose Ehlers-Danlos, which is the hypermobility condition, there is a full diagnostic criteria that you need a professional to take you through, and that will look at more than just the 9 things on the Beighton score, which is your mobility at your thumbs, elbows, hips, knees, just like the real general joints. So you would need a health professional to take you through that. And if you score within a certain range, they will send you to a geneticist.
Mm-hmm.
The geneticist will try to eliminate whether there is more serious implications for things like your vessels. So if you think about like a tube and it's extra stretchy, it means that the more pressure that's in the tube, the more likely it is going to balloon out in certain areas because it won't be able to tolerate the stretch. So it can already stretch so far. It gets to the point where it can't tolerate it. So we end up with more issues with vessels in terms of aneurysms, or which obviously is the more scary side of things. So they're going to try to eliminate that. That's quite a rare type. So most people don't have symptoms like that, but they'll want to make sure that there's nothing like that going on. And then if there's not, then you will have the diagnosis of Ehlers-Danlos. And then from there, by then we hopefully have already identified what your main symptoms are, and we'll be creating a health plan to help you target those. So that could look like going to a psychologist, going to a dietitian, going to a physio, learning about how to manage blood pressure, a holistic approach, essentially.
Okay. And it's definitely a lot of information, but at the same time, it's same again from the stuff that we've talked about. It's not an easy thing to get that final diagnosis.
Yeah.
Like, it can be not super complex, but there is a few marks that you have to hit first, and a few health professionals that you do have to see to make sure that you get onto that realm.
Exactly.
Okay.
And there is a website called the Ehlers-Danlos Society. It's a free resource. They're amazing. They're actually based overseas, but all their stuff is like broken up into sections, and also they have a directory for all different practitioners that work directly with this and who have been trained in it throughout pretty much all the main countries in the world.
That's fantastic.
Yeah, they're really good. They're a great place to go and start, and they also have quite a few YouTube clips too that just help to clarify different aspects of it.
Yep.
They're definitely leading the way. I've learned a lot from them.
And depending where we post this, we can definitely link that in the show notes for anyone, just to make this as frictionless as possible.
Yes, exactly. So one of the hardest things is that not a lot of awareness falls around EDS, so Ehlers-Danlos. So going to your GP, they may never have heard of it before, and that's where that diagnostic criteria is actually on the Ehlers-Danlos Society.
Cool.
You can fill that out, take that to them and show them that. They may have never heard of it. Don't let that invalidate you. If you do think that you do have symptoms of this, just keep looking until you find someone that will listen to you.
Yeah. No, definitely. And I think that goes for anything. If you're really concerned about something and that's not knocking the practitioner in front of you. If they don't have the experience with it, they don't have the experience with it.
Exactly.
Fair enough. I'm just thinking, because we've actually filled up quite a bit of time very quickly, which I don't think either of us expected to talk this much and fill as much information.
Yeah.
Is there anything else you'd want to fill in? Because today's been much more about the introduction, the general diagnostic criteria, things that you run into. And I know next time we're going to be far more about how we treat and what's the best way to get people out of pain and get moving again. Is there anything else you want to add that you think is really, really poignant?
I see so many people who are really struggling and who just feel like a hypochondriac. They have multiple issues going on at the same time and no one understands. So if you are one of those people, just know that there isn't a lot known about it. So definitely push to go and get it investigated, and don't let people invalidate you out of their own lack of information. So easier said than done, but I had that experience. It took me a long time to get diagnosed because everyone just wants to tell you have anxiety when really you have ADHD. So and again, there's so many different conditions in this world. And to be fair, all practitioners are just trying to do their best. So just look at it like you've got to get the right diagnosis for yourself and listen to intuition, and just don't feel like you're being a bother. If you intuitively feel like there's something not right, just keep pushing till you find that person who also understands.
Because they are right there.
Definitely.
Yeah.
Yeah.
Cool. All right. What I feel like this has been very informative for me, just as much as anyone else, because I remember being at uni and it was barely touched on. We went through, even though my degree was very, I guess you could call it hospital-based, even though I ended up working in private practice, it's almost nothing was discussed on EDS or hypermobility. And to get out in the real world, and then to see this kind of condition and how it affects people. I've had patients who dislocate their hip multiple times a year, which is crazy.
For an average population, that's
terrible.
That's really hard to do.
Yes.
And secure a joint.
And for them, they just come in and be like, oh yeah, I popped it out again over the weekend. And you think, it's stuck, but there are ways to work with them. That's for damn sure.
100%.
Okay. I think, why don't we leave it there for the information side of stuff?
Yeah.
One way I thought, and this could miss the mark completely, this is more of a way to help our listeners, again, learn a bit more about us from the other side of stuff. Because if you come in and get treated by us, you'll know we're very casual and just a little bit off-center in terms of how quirky we can be sometimes. We still get lots of good work done. We get lots of good results for the most part. But I think we do thrive on being just a little bit different than the average person.
Yeah.
So, I'm sure you just looked at the questions as well. I'm going to fire off 6 questions as fast as I can. No thinking. You just give me the first response to your mind.
Okay.
Sounds cool?
Yeah.
Okay. So ready, set, go. Favorite dog?
Dachshund.
Would you rather have a duck-sized horse or a horse-sized duck?
Duck-sized horse.
Fair enough. Least favorite bird? Doesn't have to be a pet. Could be a wild bird as well.
Minor bird.
Yeah, that's fair. What are you more afraid of, snakes or spiders?
Definitely snakes.
Yeah, okay. Give us your best move. It's a very, very afraid move. If you believe in reincarnation, what animal would you like to come back as?
Ooh, a crow.
Oh, so I will go off track here a little bit. Why a crow?
They're just so fabulous.
Oh,
Not only can they walk and fly, they also have such robust feathers. And
that's true. They look quite thick.
they're just magnificent.
Yeah. I had no idea. Fair enough. Alrighty. I think that brings us to the close for part 1 of 2.
Yeah.
And the first ever RX Physio podcast.
Yeah.
I think that went far better than we both thought it would go. That's fun. But yeah, do you have anything to sign off with? What do you think about catchphrases later?
No, I think that's good.
Yeah.
Thank you, Brendan.
Thank you. All right. Tune in soon.
Yeah. Da da da.